Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are excited to welcome Andrea Werner, who is the Chief Population Health Officer at Emplify Health. Thanks so much for being here.
My pleasure.
So, Andrea, let's start with your personal and professional journey with Leading Through Love. You spent 27 years at Bellin Health, which then became part of a merger and formed Emplify Health. You've been in leadership positions throughout your journey. And so, what has that been like, and why is leading with love such an important part of your leadership philosophy?
Well, I think I want to start off by saying that, for me, leading with love is not butterflies and rainbows, nor is it heroic. It really is setting an intention. And for me, that started when I was very, very young. I give my mother, Mary Runge, credit for this. She was a public health nurse in the inner city of Milwaukee. And as a single mom, she couldn't afford a babysitter. And I remember going out on night visits with her in the inner city, as I said, where women had babies and they couldn't afford cribs, and her with love and care, just really teaching them how to use a dresser drawer as a safe place to care for their children. Later in her career, she brought the hospice movement to the middle of our country. And I remember in the 80s in Green Bay, Wisconsin, and in Appleton, Wisconsin, we had quite a few AIDS patients. And I remember her fighting and caring through love for that population and that community for clean needles and things like that. In my own career, I decided to be a social worker and in particular focus on death and dying with babies and children after watching her in a loving career with hospice. And I think that working with families and patients in probably the most precious time in their lives and the most awful, without love, what would that care be? And so for me, it became an intention and an ingrained behavior in all the work that I do. And as I rose up into leadership roles within healthcare, I made a commitment to myself that the people who I lead, I would refer to and care for like my family. Now, that doesn't mean you don't hold people accountable, and that doesn't mean that people don't achieve outcomes. And like I said before, the land of butterflies and rainbows. Leading with love is a very specific act. But again, I think it requires intention. So through my career, and if there were people listening to this, if we were on like a talk radio show, they might call and say, hey, I worked with Andrea once and, she didn't do so great in that instance. And of course, because when you lead with love and you're intentionally doing that, you're human and you're going to make mistakes. But it's learning from those mistakes. And I can remember acutely several instances in my career where I learned and improved then as a leader through the eyes of love. So currently in my role in leading population health, I look at the communities that I serve. I look at my colleagues, the people on my team. And again, with intention, focus on treating them with care. Something really exciting happened when we came together as Emplify Health. So, two organizations, Bellin Health in the Green Bay area, Gunderson Health System in the La Crosse area, and there's broader geography there, but I won't get into that. We came together 2.5 years ago, and most people complain and think about like the bad things that come with mergers. I remember acutely the concept of leading with love and how that really became a beautiful part of our merger. So Gunderson actually had a tagline or a philosophy that was love plus medicine. And another way to think of love plus medicine is caring for patients is art and science and psychology, right? It's all those different things. And in the Bellin region, we had similar intentions just in taking care of our employees. But as a brand new executive team of 10 people under the leadership of Dr. Scott Rothgaber, we began to flesh out our leadership philosophy. And our leadership philosophy is grounded in leading with love. And so we worked on setting, what does that look like? Defining it, like how do we lead with love? What are our empathy principles in that? What are our excellence principles in that? And over the past year have worked on building that out. And now we're rolling it out to our leaders. And we have a Leading with Love course. I actually took it myself last week. And organizational development just took and ran with it and put together a really beautiful course. And our annual leadership summits that we have, where we convene both clinicians and non-clinician leaders, is grounded in our leadership philosophy. So it's been a really exciting journey to organically come together and intentionally put together a platform that puts it out to the universe, that we're committed to leading with love. And the last thing I'll just toss in there, our name, Emplify Health, is a portmanteau of empathy amplified. So we're basically making a commitment to our patients that we are going to deliver care with kindness and empathy and love. And as leaders of the organization, if we're going to expect our teams and employees and doctors and everyone to deliver empathy amplified, we have to equip them with the tools to be able to do that.
Wow. Wow, that is quite a journey. Unbelievable. And I'm just tempted to jump in so many different parts of it. The personal journey is just remarkable. Your mother and, and what you learned just by being by her side. Such amazing stories, very, very touching. So I really want to get into that. But my mind, I think, is stuck right now where you kind of left off because I keep thinking 2.5 years ago, this system came together. What an amazing story that you feel that the merger actually created this kind of humanistic value. When, for the most part, in the media and in the articles, for the most part, we talk about mergers, creating monopoly power and increasing prices and becoming more bureaucratic. And you're here, you're talking a completely different story. So that is just profound in itself. I think what's really striking me is how deeply you and the leadership team and all the teams that you're describing at Amplify Health have gotten into this and taken this on and run with it. Why do you think and how do you think you're able to be so far ahead of where we perceive other health systems in the country? Because, Stephanie and I will talk to a lot of different leaders, and so many of them are still so hesitant and reticent about using the terminology of love, let alone empathy or compassion even. So maybe you can tell us a little bit about how does this system, the two systems coming together in Wisconsin, what made them think that this is what we need to do and this is the right time to do it?
I think it is the values that we have, and thinking those through. I mean, when you come together in a new organization, you start from scratch with everything. Our vision statement, get this, our vision statement, leading with love, we courageously commit to a future of healthy people and thriving communities. How amazing is that? That's why I show up here, every day. How amazing is that? Like,
Yeah.
I feel so privileged in my career to be able to have worked for an organization. So it starts with the board, right? And then it starts with your leadership. And so, yeah, when we designed our mission and our vision statement, like, it is grounded in leading with love. And we feel that differentiates us, that makes us unique from other healthcare systems, and that will help us be the provider of choice in our market. Um, and so, do we are we perfect at it every day? No, of course not, because we're learning. And part of leading with love is, you know, transformational change and creating a culture of belonging and being accountable for outcomes and building high performing teams. Like, there, it takes work. But I do believe, like, humbly, we're learning every day. I would never say, oh, we're amazing and perfect at things. But I do think that through leadership and through our board and our CEO and the team that he assembled, we brought our unique perspectives, and all 10 of us were 100% committed to this principle. Now, were definitely there's still squirming in chairs that you might see when people talk about love. And people will say, I don't know how I feel about this love word. Like, I'm a little comfortable about this love word. And I think that's why it was so important for us as a leadership team to clearly define what that is and what it isn't. And that's where the leadership philosophy came from. That's why we have our principles. And I'll read to you. Our leadership philosophy statement is, by leading with love, we inspire and support all to serve with empathy and excellence, creating healthy environments where everyone can develop, contribute, and thrive. So we really took it a step further through the eyes of the employees. And again, this is new, you know, and I would love, and one of the things I'm super curious about, if anyone's listening out there and has this nailed, please feel free to reach out and email me. I think designing systems of measurement around this, I would love to be able to, and we're thinking this through right now, to be able to have baseline measures and then to show like over time our employees are more loving. And that, imagine that, to be able to put that out there. So I think that's really the next forefront in this is, how can we be outcome obsessed to show that we're a loving organization? And there's lots of talk about all of that, but I'm super excited about where that could go.
You talked a lot about how the journey is not necessarily easy. It probably is a bit easier given that both sides were already doing this. And you said that when they melded together, it really, maybe filled in. So in my head, I'm imagining like slime because I have an almost 10-year-old. So I'm imagining colors of slime squishing together and that being how this is going. Sometimes that slime's not going to be the perfect consistency, or the color is different than you originally planned, or you got beads in the wrong part, whatever it is. So to me, I feel like it is a little bit like slime. It's good. You know that you're going to get there. It's helpful that both sides are interested in being invested in that, but it doesn't mean that it's easy. And you said that you spent a lot of time defining what love is. So how do you know, one, as a leadership philosophy and having a loving leadership, is part of that loving your employees so that they can then filter that down and giving them that ownership to do the right thing? And then how do you know, or how do you convey what isn't love?
That's a really good question. Well, you can imagine that someone could show up in your office, and you're trying to hold them accountable maybe for some not so great behavior. And the person will look at you and say, hey, but I thought we lead with love. I can't get in trouble for that. Accountability is a very strong part of leading with love. When I was growing up, my parents would coach and counsel me if I was going in the wrong direction. That was loving. That was a loving act. And so I think having a lot of conversations about, what it is to lead with love. And that's like, again, why we fleshed out this leadership philosophy and why we have I'm accountable for outcomes as one of the excellence principles in what we do, is that, creating clear expectations, holding people accountable for expectations, creating clear ways that people can see that they are successful, um, clearing the path and making it possible for people to be successful and thrive, for us is a way to lead with love. So again, that's why I like to say leading with love is not all butterflies and rainbows. Everybody gets to do what they want. It's building a culture where you're all moving together towards that vision statement. Leading with love, we courageously commit to a future of healthy people and thriving communities. We're rowing in the same direction. We know where we're going because we have measures that tell us when we get to the destination. So I think that's really where we've set our intention is to flesh it out in a way that resonates with people, where they can see that it's real.
Really an amazing vision, amazing vision. Again, I just tip my hat to you and the entire leadership team at the system for having this foresight. Because again, I think from a national perspective, I would even say, dare say, an international perspective, because our Loving Organization Consortium movement is pretty international, though maybe not as well represented everywhere. We don't hear a lot of organizations and health systems that are at this cutting edge. So I just feel incredibly inspired and emboldened to now ourselves say, hey, we could be leading with love. We need to learn. And I think that's the role model you folks are trying to set for us, which is really, really amazing. The question I would have for you, Andrea, pursuant to that is, do you think your staff are starting to feel the impact of it? And is it evident in more anecdotes and stories, or is it showing up in any kind of numbers there, like turnover or burnout or anything like that, just culture or something like that? And or also, do you think your patients are starting to see the impact of this? And is that showing up in any outcomes?
Well, the fun way that it's showing. So we have the basic, we do our employee satisfaction surveys, all these things, and we're monitoring it. I mean, this is a relatively new thing, and I would say generally, we're moving in a positive direction, but it is relatively new. So I think it would be disingenuous to say, oh yeah, we're seeing all these outcomes right now because it is new. Anecdotally, what's super beautiful is just to see the staff light up. Where I see it the most is in interactions with patients, and we have this little character, little empathy, that's a heart, that's our, kind of our little mascot for the organization, and the kids are running around, hugging this little heart, and you can see that people are starting to associate our brand with love, and that's really really exciting. And I also see it in interactions, between peers. So there's a lot of, if I'm not a huge social media person, but when I do look on LinkedIn for, professionally, you see a lot of posts of team members posting examples of leading with love. So to me, that is showing us that we are going in the right direction for sure. You talked up, Perv, about internationally, one of the things that I'm really curious about is the leadership philosophy and leading with love, and how might other cultures adapt this in different countries, and what would that look like? What, how might it be different based on those nuances? I think would be really fascinating.
Totally, totally. And we are by no means exhaustive in that front because, again, it's just spotty. But what we're hearing, for example, is a few collaborators we have in New Zealand who are saying that, New Zealand is really going to be out front on this, but they may not call it love. There, they may call it more kindness or caring. So part of it is a semantic thing that we sometimes get bogged down in. But they think the culture in New Zealand is already along those lines. And so just encouraging that now more in organizational context, could emerge. On the other hand, we've got a country like India where we have some collaborators who are working on this as well. And there, again, I think there's a sense that love is important, but it needs to be present in the individual. So it's a much more, ironically, you would think, because it's much more of a gregarious, family-oriented, civic-oriented society. But there, the sense that we've been getting from early collaborators is, yeah, this is great, but this is for the individual doctor or nurse to figure out how to practice that way. So oftentimes that
Interesting.
seems sometimes is the struggle. People in general, I think even in the US, where I think systems-based work is most advanced, still struggle to understand embedding love into systems, and we tend to think
Yeah.
of it more the province of individuals.
Yeah.
But it's definitely much more for us to learn. Yeah, please.
And even in these two organizations, like I said before, in the Gunderson region, they had this, love plus medicine. Like they were already using that. In the Bellin region, we never said the word love out loud, but yet we would do things like we had Dr. Len Berry, wonderful, wonderful man, come do some research on how we were taking care of cancer patients. This was many years ago. And of course, what he found is that, we were caring with kindness. Like that's what differentiated us. And we know the work of Maureen Vizigiano and kindness and compassion and what matters to you and all those things. And I think that all those things connect and are great tools and resources to use in the space of thinking about kindness, empathy, compassion, and loving organizations. I think that it's like a puzzle, and it's like a river and a stream where there's all different directions. I don't think there's a right way to do this. I think that it is up to each unique organization. And I do think it does take a commitment within your own self. And I think we could use a whole lot more of love in a lot of places right now.
What I've heard throughout all of your comments really kept coming back to clarity. There's clarity in all of this, clarity in who we are, clarity in what we expect, clarity of what we're giving our patients. And even in the hard moments, you've talked about the clarity. And that's what is one of those things that sort of eases any of the bumps that you might hit. And that's an interesting theme, a Apoorv, that you and I have heard through a lot of different people, from Eric Anderson to Kirsten Liebar and even then the visual cues too, like you were talking about, Andrea. We had Catherine from Spongies. We had Love Evolve. All of these people, so there are all of these themes that are interesting that you're incorporating. And so you're doing all the things that we've heard, all the individual components that we've heard, from the visual cues to making sure that we're clearly communicating with people. And so what is it that you want people to leave this when they're leaving your building, whether it's as an employee, whether they're leaving as a patient who's getting discharged, a family's patient who may have lost them or maybe getting good news, any of them? What do you want them to leave Amplify Health feeling?
I want them to feel like I will know you. I will show you respect. I will go with you on your journey. I am here to care for you.
I love that. Thank you so much. Thank you for being here. We really appreciate your time.
My pleasure.
Beautiful. Couldn't
Thank
have
you
been a
for
better journey with where you brought us to. Unbelievable. Starting with your own journey to the organization, and now you just held the patient's hand and narrated it so beautifully. Thank you so much for that, Andrea.
thank you all
Awesome.
for watching. We'll talk to you soon.